When was the last time you had your blood pressure checked? If you had your last checkup many years ago, and your BP reading then was somewhere around 130/85, and you think that that is still okay, then have your blood pressure checked again. Because for some years now, the definition of hypertension has changed. Let's talk about high blood pressure, also known as hypertension. What is hypertension? Hypertension is a medical condition wherein the blood pressure in the arteries of the human body has been persistently high for a long time. This is one of the leading causes of cardiovascular disease and is known as the silent killer, since many patients remain asymptomatic for many years until a vital organ has been damaged. These organs include the heart, kidneys, retina, and the brain. What are the types of hypertension? The two main types are primary hypertension and secondary hypertension. Primary hypertension is the more common type, seen in 85% of the patients afflicted with it. No organ system has been identified to be the cause, and this type of hypertension is believed to be inherited. It develops over time as one gets older. On the other hand, secondary hypertension is high blood pressure whose cause has been identified. Causes include kidney diseases, hormonal or endocrine diseases, substance abuse, and medications. Except for some conditions such as coronary artery disease, coarctation of the aorta, or aortic valve stenosis, in many instances, the heart is not the usual cause of hypertension. Rather, heart disease is its consequence. Because the heart has to work hard to pump blood, its walls thicken and become stiff. As the heart size enlarges, it will need more blood supply for it to function. This leads to heart failure and arrhythmias. What are the contributing factors to hypertension? Contributing factors to hypertension are age, obesity, stress, sedentary lifestyle, smoking, excessive salt consumption, and sleep apnea. Who are considered hypertensive? Last 2017, the American College of Cardiology, the American Heart Association, and many other international organizations have given the definition of the different stages of hypertension. Take note that the new normal is now less than 120/80. Elevated blood pressure is seen with BP 120 to 130 over less than 80. Stage 1 hypertension is when the blood pressure is between 130 to 139 over 80 to 89. Stage 2 hypertension is when BP is more than or equal to 140/90. There are no numerical stages after stage 2, but once the blood pressure reaches 180/120, the condition is now termed hypertensive crisis, which is divided into hypertensive urgency and hypertensive emergency. Hypertensive urgency is when the blood pressure is 180/120, but there is no organ damage, while hypertensive emergency is when the blood pressure is equal to or more than 180/120 and there is already an existing organ damage. The reason for the lowering of the threshold is because when the interventions were started only at 140/90, the risk of cardiovascular complications such as stroke and heart attack continued to rise. Now, with a lower threshold and subsequent earlier treatment, complications may be prevented. The interventions for these stages will be discussed in a while. Before this, allow me to discuss the consequences of hypertension in our bodies. We all know that the heart pumps blood, which delivers oxygen and other nutrients to our organs by flowing through the arteries. With hypertension, the heart pumps with more force than normal. Constant excessive force against the walls of the arteries may result in the following consequences. 1. Narrowing of the lumen as a result of damage to the inner lining or endothelium of the artery. 2. Inflammation of the blood vessel. And 3. Aneurysm. Let us discuss each consequence. Narrowing of the lumen as a result of damage to the inner lining or endothelium of the artery. The endothelium is the inner lining of the blood vessel that is responsible for the prevention of plaque formation. Once damaged, like for example, a tear was formed, then there is already a high risk of plaque formation. Plaque formation is the deposition of cholesterol, fatty substances, calcium, fibrin, and other waste products that leads to the narrowing of the arterial lumen. Once there is narrowing, it will be hard for the blood to pass or squeeze through the blood vessel. The consequence, the pitiful heart pumps harder, and the blood pressure continues to rise. Take note that plaque formation may start during childhood. 2. Inflammation of the blood vessel. The constant high pressure in the blood vessels can actually trigger an inflammatory response within the vessel wall, which can lead, again, to plaque formation that is composed of white blood cells, macrophages, cholesterol, fibrin, and others. 3. Aneurysm. Stretching of the elastic fibers in the arterial wall makes it less flexible and more prone to injury. Just like a garden hose that takes the brunt of high water pressure, the arterial wall may balloon or become an aneurysm, which later on may rupture, causing excessive bleeding and death. What is the management for each stage? The goal is to have a blood pressure of less than 130/80. If blood pressure is normal or less than 120/80, one can maintain his good lifestyle and just follow up with his physician every year. If there is already elevation of blood pressure, meaning less than 130/80, one can already start with lifestyle modification mentioned earlier, and he is advised to follow up with his physician every 6 to 12 months. If the blood pressure is now between 130 and 139/80 or grade 1 hypertension, there is a fork in the management. If there are no comorbidities, the patient can just start with lifestyle modification and follow up with his physician every 2 to 3 months. Laboratory tests such as chemistry panel may be requested at this point. However, if there are comorbidities such as diabetes, congestive heart failure, coronary artery disease, renal failure, and peripheral artery disease, aside from lifestyle modification, antihypertensive medications must be started. What does lifestyle modification mean? Lifestyle modification means changing our habits to improve health. In hypertension, there are 4 areas that need to be changed. These areas are diet, exercise, weight loss, and cessation of smoking. Let us start with eating a healthy diet. Cardiologists advise us to follow the DASH diet, which stands for Dietary Approach to Stop Hypertension, encourages us to 1. Eat grains, vegetables, fruits, nuts, organic dried fruits, lean meats and dairies, and to avoid saturated fats. 2. It encourages us to limit our daily salt intake. By the way, although many people use salt and sodium interchangeably, they are not the same. Sodium is a mineral found in salt, while salt is a compound made of sodium and chloride. Our salt intake should be limited to less than 2.5 grams per day, or 1/2 teaspoon of salt, or less than 1,500 milligrams of sodium per day. We need to limit our salt intake because it attracts water. Since its consequence in our body is water retention, this extra water stays in our blood vessels, and its presence there results in a higher pressure in our blood vessels. The ultimate consequence is hypertension. The DASH diet also encourages us to increase our intake of potassium-containing foods to at least 3,500 milligrams per day if we have no kidney problems, and these include bananas, green leafy vegetables, avocados, dried fruits, carrots, potatoes, tomatoes, cucumbers, zucchinis, eggplants, pumpkins, oranges, and many more. Why do we need to eat potassium-rich foods? Potassium-rich foods help lower blood pressure through two mechanisms. One, by reducing the effects of sodium by removing it, and two, these foods relax the blood vessel walls. Lastly, the DASH diet encourages us to limit alcohol intake to less than or equal to 2 drinks per day for men and less than or equal to 1 drink per day for women. Number 2 in our lifestyle modification is regular exercise. Regular exercise is defined as engaging in aerobic exercises, resistance training, and isometric exercises for a minimum of 30 minutes per day for most days of the week or for 150 minutes per week. Regular exercise or physical activity makes our hearts stronger. A strong heart is able to pump blood with less effort, thus helping in reducing blood pressure. On the other hand, a sedentary lifestyle contributes to artery hardening and plaque buildup in the arteries. With stiff and narrowed arteries, the heart has to pump harder, thus increasing blood pressure. What are some examples of aerobic exercise? These include walking, jogging, cycling, swimming, and dancing. Examples of resistance training include push-ups, sit-ups, squat thrusts, lunges, leg adduction, weightlifting, bench press, and planking. And for isometric exercises, some examples are leg extension, V-sits, and calf raise holds. The third strategy in lifestyle modification is weight loss. The goal for weight loss is one's ideal body weight. It is wise to note that a 1 kilogram reduction in body weight is equivalent to 1 millimeter mercury reduction in BP. The table below is a good guide. The fourth strategy is cessation of smoking. This is non-negotiable in lifestyle modification. Why? Simply because smoking causes hypertension through many mechanisms, and these include release of adrenaline, blood vessel constriction, and damage to inner lining of the blood vessel. What are the effects of cigarette smoking in our blood vessels? First is the release of adrenaline. Nicotine in cigarettes stimulates the release of adrenaline or epinephrine and norepinephrine, which increase both the heart rate and blood pressure. Secondly, it causes constriction of blood vessels because nicotine causes smooth muscles in our blood vessels to contract, resulting in the narrowing of blood vessel lumen and thus increasing blood pressure. Thirdly, it causes damage to the inner lining of the blood vessels. Smoking damages the inner lining of the blood vessels, and its consequence is plaque buildup. And lastly, cigarette smoke contains numerous oxidants that cause oxidative stress that damages cells and tissues, including the endothelium of the blood vessels. What are the first-line medications for lowering BP? This topic will be taken up in the second part of this lecture series. Watch out for it. In the meantime, you might want to read more about topics on cardiology. Our new book, simply entitled Cardiology, is now out, and may be purchased online. Our A to Z of Medicine team is always available to assist you. Thank you.